It's actually very common in our environment, but because very little attention is paid to the condition, few people know what autism is in our environment, and that's something that has to be tackled. So a lot of children have autism, but most times the parents just say, it's a spiritual problem. They go to church, they go and pray,
Okay.
they go and they just hide the child.
All right. Okay.
And
For some parents, I like the fact that you said that sometimes people blame autism on spirituality, and then there are some parents as well who don't know when their child have autism, which brings me to the next question: is it possible that a child can be born without autism, and then at some point the child gets autism, say with cases like convulsion and things like that?
Not really, because autism does not really manifest at birth. Child could just be developing normally, and then from prefers to stay on his own, doesn't want to interact with his peers, or it's as they grow older that you start noticing the symptoms of autism. So they may not present with anything at birth. You won't even know that the child has autism, but the disorder is already there, and it will just manifest later in life. And it's a spectrum. So from very mild to very severe form of autism exists. So they're called autism spectrum disorder.
But it starts mild.
No, some people can have a milder form,
Okay.
and some can have a very severe form that they need assistance every day in their regular activity. So for those who have a milder form, they could develop proper learning skills and become integrated with regular
We'll get to
children.
that. We'll get to that because we're going to try to dissect this
So,
as much as
Dr.
possible.
Onyinye, let me come to you. First off, is autism, is it hereditary? And secondly, statistically, it said that about 1 in 100 children or 1,000 children are autistic. It tells you that with the rate at which children are born, there is need for sensitization, just as we are doing here. So how do we talk, or how do we curb the rate of stigmatization? Because it's also a problem that is associated with autism, and this stigmatization comes as a result, most times, ignorance. So how do we deal with the problem of stigmatization in autism, and is it hereditary?
Okay, first of all, autism, main cause, like my boss has said, it can be hereditary, although the cause is not known. But they've discovered that in siblings, there tends to be higher chance of having autism in siblings. That, or if you have a sibling that has it, the next one might be even identical twins. There's an increased chance of getting it. Then but environmental factors still play a role. If something like increased paternal age and exposure to pesticides, like when the child is in some hard drugs.
Okay, sorry to interrupt you, Dr. Onye. With what you said now, can someone have autism as, will I say, a recessive gene? It doesn't come out, but then when he gives birth to the child begins to manifest it, and like that.
It's not inherent.
Oh, it's not dominant or recessive.
It's not
okay.
dominant, but it's like a lot of factors come into play, genetics and the environmental factors. For people who want to get in it, if they are exposed to some environmental factors, the child can get it. But still, like, research is still ongoing to know the actual cause, but it's just genetics and environmental causes.
How about the stigmatization aspect? Because it's a huge problem right now.
Like educating people, it's about, this is how we can support your peers with autism. This is what we can do. Once they get to know about it early, we can reduce stigma. Another way we can also increase education awareness in the community, in marketplaces, at town hall meeting, like elaborate on what autism is all about. Like, these are people in our society. These are the challenges they face. These are their symptoms. This is how we can help them, and where we can help them, or where we can come in to help them. Then direct them to sources like their NGOs that support autism, and there are even a Ministry of Women Affairs have they have a rehabilitation department that can support families that have autistic children. We have the Umata Foundation. We have the Umbridge Foundation in Delta State.
Okay.
These people support.
All right. Okay, Dr. Onyinye, I'll tell you something. Many of these things that you're talking about right now, people have not heard about them
At all.
especially with the initiative you're talking about from the Ministry of Women Affairs. So, Dr. Peace, yes, because you're a consultant pediatrician, I would want you to buttress on this. Let us know more ways on what the advocacy rate is like on autism awareness and, of course, campaign, especially because at the moment the awareness is very low. And at the beginning, you also said that autism, some persons blame it to spirituality. Until now, especially in the rural area, people still blame it to spiritual issues. And sometimes when families give birth to children with autism, deep inside their heart, they almost wish that the child didn't survive or the child should die. But in real sense, I know that there are great celebrities who are autistic, who have done well in life. So as much as possible, we want to dissect this and break it down so that people out there who probably have lost hope would understand. So let us know, buttress, what are the awareness? Is it a continuous process, especially in the rural area?
Okay, thank you. I think that recently the condition autism is coming to the fore in Nigeria, because maybe in places like Lagos and Port Harcourt and Abuja, there's more awareness about autism. They have centers where children with autism can go for their learning and care. However, when you come down south, it's the reverse. It's you see centers, they manage children with Down syndrome, cerebral palsy, autism. They're all lumped together, and all of these conditions have various peculiarities that require different modalities to approach their care
really?
and management. Yes.
Okay.
So it's that prevents each of these children with these different conditions from getting that individual care that they require. So it reduces their potentials in the future. So it's very essential that we start with advocacy and awareness creation. And I must commend the team, which we are working. The head of service is retiring, and he chose to work. He said we should focus on autism. So because probably he realizes that little is being said about autism, and it's essential that people begin to know that there's something called autism, and that it's not a spiritual problem. It's not also a death sentence. It's not an illness per se, like you have malaria, so you just take anti-malaria and you are better. It's much, much different from that. It's a condition that requires lifelong management with several methods that can help the person become integrated into regular life in society. Like you said, a lot of people do well when they have proper care for autism. So like people in Western climes, they have better outcomes than in our environment. So basically, like for the rural areas, it's essential that we break it down to a way that they can really, really comprehend. So like in schools, we could also say, okay, children in primary schools could be taught about developmental disorders to understand that people with cerebral palsy who can't speak or can't walk are not, they're not witches, they're not ogbanjes, they are regular human beings. They just had issues when they were developing, and it's resulted in this situation. So it's essential that from when someone is young, it's essential that you start helping them to accept people who have different abilities. So we don't want to use the word abnormal. Say, okay, this person is differently abled, so that it encourages more acceptance of the condition of that person. And it's not something that you can touch the person and spread to you. So it's not contagious. So because some people feel that if you interact with that child, you get autism. So they need to be aware that this is a condition that requires lifelong care, and it requires us to provide love to such people and acceptance, because as much as stigma is present, it prevents them from developing and achieving their full potential. So it's essential that advocacy for those in policymakers create environments that are conducive for people to know about autism, and create environment where people with autism can receive care, and maybe even make laws that will help more people know about autism, and help schools provide environments that patients with autism can receive proper education, and workplaces too. Because if somebody with a differently abled ability goes to get a job, the average employer is likely to say, this person is not going to be able to work in my establishment, maybe a problem. But if there are laws and making it compulsory for you to engage such people, maybe to a certain percentage, it will encourage those people to seek jobs, and more people will employ them, and to give them more opportunity to get integrated into the society. So beyond starting from when children are in primary school, to create awareness about these conditions, and then churches, marketplaces, the news media, like what you are doing now.
Yeah.
We are the ones who will speak about autism so that people can be aware of it. Then create centers where people with autism can receive care.
I was coming to that. I want to put you on the spotlight as the CMD of ASH. Is there like a center, a help center in your facility?
Okay, we have a neurology clinic because it's a neurological issue.
Okay.
So the consultant is in pediatric department handles patients with autism.
How about a support group?
We don't have a support group, but I know that there are centers that have support groups in town.
Okay.
Like the Umata Foundation that I mentioned, it's the charity arm of Her Excellency, and she's very much interested in autism. So she's been doing some work on the condition, creating awareness, and I know that with time she has plans to go further with it. So it's a lot of there are other people who are also working on autism in Asaba, and creating awareness and support. They have support groups, because I have a colleague whose child has autism. So from the regular school the child goes to, in the afternoon goes to the support group, where he goes to the other school where they teach all this behavioral, because they require behavioral therapy, they require speech therapy, they require sensory stimulation to help them adapt to interacting with other people. Because one major issue is interaction. So they could just sit in a place, they get triggered. When I say triggered, they become very anxious when they are put in a crowd, or when they come into a very unfamiliar environment. So they require this therapy to help them cope with real life situations that are just normal. But when they are thrown into such situations, they become very anxious, and they could become violent. So they could become just start crying, break down emotionally, and all of that. So it's a very broad, multifaceted medical condition that requires a teamwork, multidisciplinary approach to management and care.
Okay, so CMD, at the beginning you said autism is caused by a combination of different factors, not a specific factor, genetics, different things. So currently, are there new or emerging therapies, technologies, or research that could help autistic individuals?
Yes, sure. Currently, of course, medicine is evolving from medications which are not really curative for the condition, to therapeutic measures, cognitive behavioral therapies. They have issues with speech, like I said. So they've discovered recently that sensory stimulation, exposure to sensory, when I say sensory, like maybe if they get triggered, just okay, let them go and swim.
Yes.
Or they have these sensory toys. So you have a place in a center for autism, they could have a sensory room. So that room is, whenever they are emotionally stimulated or triggered, you just put them in that sensory room. Some of them can play the keyboard, they are very good at it. Some of them can just go to their toys. As they are touching it, they get calmed down. And medicine is, there's a lot of research ongoing, and hopefully we should get to a point where we can find a lasting if not a cure, but at least to a point where the condition is managed and people can actually live their normal life like every other person. We're not there yet, so it's a work in
It's a
progress.
gradual
Yes.
Dr. Onine, there's this common myth that says that when children with autism mingle with other school children in normal schools, I don't know how to put it, but I guess you understand what I'm saying, that there's, with time, you start to notice that that autistic trait dies down to a minimal. I don't know how true it is, but that's what people say. Presently, for example, my children's school, they have children who are autistic in their classes, and the moment my child says, oh, there's a special child in my class, I know what they're talking about. But is it okay to mingle all of them together? Is there not the place where one child, the autistic child, might be slow at learning, and then the teacher might become frustrated and then neglect that child? I truly want to know, because there are parents out there who send their children to just any school where other children are to mingle, because they've been told that if they mingle with other children, the autism dies down with time.
So, well, that can be true, but you know, autistic children, it's a spectrum. You have the mild, you have the severe form.
Okay.
So, education should be tailored to their own specific, to an individual specific needs. Okay, for example, why one child will do well with mingling in that kind of school, another child with autism may not do so well. They may even become triggered. So it's we say it should be like a structured thing. Slowly you try to get them to mingle. It's something that you just don't do so fast. Little by you get them to mingle little by little.
So is that the work of the parents or the teacher?
The education, the educators usually know how the best education suited for the child.
Okay.
In this case, so in some cases they could get some of the some children could get a one-on-one. That's like a one teacher
Okay,
to
one-on-one tutor. Okay.
tutor that is usually patient with this set of children and could teach them.
Is same class with the other children, or
Maybe
like a different lesson?
It can be a different lesson. It can be in the same class, but somehow they could coach the children to achieve, to reach their full potential.
Okay, Dr. Peace, would you want to add anything? I see how you're nodding.
It's like she said, the education of the child is tailor based. It's tailored to the specific needs of that particular child. So if a child, of course, inclusivity, that's allowing them mingle with regular pupils,
Yes.
is the ultimate in care.
Okay.
Yeah, it's strongly advocated. However, you must be sure that this child you are allowing to mingle with other children is not going to be violent, is going to be able to cope with those other children, and will not be too slow in adapting in terms of learning to his peers. So like you could see a 10-year-old child is in the same class with a 6-year-old child, because that is his developmental age educationally. So you could see a situation like that, but you could also see that some situations where age range is at par. But this is just based on how the assessors have looked at this child and say, okay, this is what is best fitted for this person. There are some, like she says, it's a spectrum. So for those with milder forms of autism, they could actually mingle with other children, attend regular classes, and over time become achieve the same level of education as their peers. But there are others that require one-to-one care, and there are still others that require 24 hours assistance to eat, to go to the toilet, to move around, everything. So it's all tailor-made to fit the particular spectrum that the child belongs to.
Okay.
So the key thing is first get diagnosed in a hospital. A lot of people don't know that they just go to a hospital Federal Medical Center, a super specialist hospital, see a pediatrician, and they'll diagnose the child properly.
Okay.
And then once the diagnosis is made, the pediatrician will refer the person to where he can get help.
Alright.
So and such I have been opportune to manage some children with autism. I've had them a set of twins that had autism.
Two of them.
Yeah,
Oh,
two
wow.
boys. Yeah. So it was actually the head of the school that noticed it and sent them to me.
Okay.
So because parents naturally will reject that diagnosis, so they were in denial. So we had to counsel them. Acceptance is key to giving these children the best in life. So we first had to counsel the parents to accept the condition. They went away for a while, but they had to come back and accepted. Then we started working with the teacher to know the best fit for those children. They are doing better now since they've been able to start learning how to speak some words. So they speak differently than other children sometimes. They could say their words in a different way than regular children do. So, but you just have to work with them according to their own pace. And for those children, they have to be placed in special classes, special aspect of the school for special children, and have some classes with the regular kids. So it's all based on how the teacher feels that this child will benefit the most. That determines what you do for the person.
Dr. Peace,
Yeah.
your last words very quickly.
Okay, well, like I said earlier, autism is a very common condition in our environment, but very little is surprisingly being said about it. I want to encourage policymakers, people like you who are in the news media, and even people like myself and Dr. Nye, who are health practitioners, to ensure that our adequate awareness is created so people know what autism is, where they can go to get care, and then create an environment that is free of stigma so patients with autism can achieve their full potentials. Thank you very much.
Thank you so much. One sentence, your last one.
Okay, autistic autism, the key is early intervention.
Early
If
intervention.
we intervene early, many will live a well-fulfilled life.
All right, thank you so much. Okay, we've been speaking extensively with Dr. P. Sigo Sewe, and she's the CMD of Ash Hospital, also a consultant pediatrician. And we've also been speaking with Dr. Onyinye Omumo. She's from the Ministry of Health. And our topic today has been centered around autism and its management. Perpetual, your last words.
Okay. Autism is a special need, but in as much as it's a special need, those with autism should not be discriminated. They should be shown the adequate love, care and support that they need, bearing in mind that this set of people are an integral part of the society.
All right, from me, I would say that early intervention is key. And that's where we wrap it up on Thursday's edition of Morning Ride. Until we come your way tomorrow, I'm Cheesy Awuno. God bless Delta State and God bless Nigeria.
All right.
Thank you for tuning in to today's episode of Living the Life. We're always excited to share real life issues and solutions with you, and we are grateful for your feedback.
And for your engagement on our social media platforms. It's great to know how positively this program is impacting your lives.
Yes, life can be very difficult, and so often we hear the question, why do bad things happen to good people? We may never be able to control the unfortunate experiences life hands us, but we can sure determine how we allow them to affect our lives.
And that's why today we want to talk about the emotional or mental hurt you feel when something bad has happened to you. Simply put, trauma.
Yeah, I mean,
Trauma can take a toll on people's lives.
yes.
It can.
And sometimes you may not even know it's there, right? I remember when I had a miscarriage for my first son, before my first son came. And I started asking myself, Lord, did I do anything wrong? Was there something I should have done to avoid this? Somehow it was my fault, right? And for a long time, that feeling of
Stayed with
yeah,
you.
it stayed with me. Of
Yes.
guilt, like, no, I'm responsible for
Yeah.
this, until God intervened in my life, and somehow I started feeling this peace spraying, and I just kept praying and saying, Lord, I know you know everything. I know
Right.
you knew this was going to happen. I
Right.
know. I kind of just threw my weight on God and just
On
said, Lord,
God.
just
And that's the way to do it. Sometimes you need to talk to someone also.
yeah.
To unpack what the issue is, because sometimes for some people they can't even like place a finger on it, and they're
True.
just, what is happening? Why is my mood like this? Or I thought this happened a long time ago. Why am I still, going through the trauma and all of that? Yeah. It can really take a toll on people.
Yeah. Now, just because an experience is hard doesn't mean there's no way out. Sometimes the very worst thing that happened to us can turn out to be the very best thing. After the break, our guest will take us through the process of recovery and healing from a traumatic experience. Please stay with us.
Welcome back. With me in the studio is Dr. Chika Etok. She is a public health physician with over 35 years experience in the medical profession and a former country medical advisor of Unilever Nigeria. She is currently the principal of HealthWise Concepts in Nigeria. Dr. Chika is trained and certified in crisis counseling by Institute of Counseling, Glasgow, UK. She is also certified by Trauma Healing Institute of American Bible Society, USA, as a healing group and training facilitator. Dr. Chika Etok is married and is a mother to 3 grown-up children and a grandmother to a delightful boy. Welcome.
Thank you. Thank you very much.
Thank you so much for making it here today. We're so happy to have you.
It's a privilege and a pleasure to be here. Thank you for inviting
And
me.
you look really, really beautiful.
Thank you. You look lovely too.
Thank you, ma'am. So I'll just dive into the questions and trust that we have like insights on this topic, trauma. So what would you say is your understanding of trauma, and what is the impact on an individual's physical, emotional, and psychological well-being?
Okay, so many times people go through experiences that cause them a lot of pain in their heart that takes a very long time to heal. And essentially, that is what trauma is. Trauma is a deep wound in the heart and mind of a person that takes a long time to heal. And it's characterized by a sense of helplessness, intense fear